Good day everyone, I'm David, the moderator for this webinar. I welcome everyone for today's webinar, which is Medicare Advance Beneficiary Notice, CMS Update Rules and Guidelines. I would now like to introduce our presenter for today, David Vaughn. David Vaughn, JD, CPC, ESQ, is one of the top healthcare attorneys in the United States and is the founding member of Vaughn and Associates LLC. David has served on the legal advisory board of the AAPC and has written several coding and compliance books and manuals. He is also a national speaker on the legal implications of billing and coding. I would now like to hand over the floor to the speaker. Over to you, David.
All right. Thank you, David. We're going to talk about Medicare ABNs, current CMS rules. First, the basics. What's an ABN? That's an Advanced Beneficiary Notice, ABN. It's a mechanism to tell the patient, hey, guess what? Medicare is not going to pay for this, so you're going to have to come out of pocket. And so it's a notice to the patient that they may have to pay out of pocket. Hey, this is what's not covered. You're going to have to pay this out of your pocket. Medicare has an ABN booklet that they put out. They update it, every so often. The most current version is June of 2022. The actual source document is in the Medicare Claims Processing Manual. You can use an ABN, a single ABN, for extended treatments that are not covered. That's a data field. There are data fields A through H on the ABN form. And you have to put the duration that this ABN is going to cover. You can't make an ABN retroactive. So even if you dated it today, you didn't backdate it, you dated it today, but you want to make it retroactive for a prior date of service, you can't do that either. Medicare has 4 parts, Part A, B, C, and D. Okay, Part A is hospitals, that's inpatient, includes hospice, home health agencies, hospitals. ABNs apply in that arena, those facilities. Part B, that's essentially physicians for the most part, and ABNs apply to Part B. That would include both physicians and SNFs, skilled nursing facilities, home health agencies. Part C, Medicare Advantage, no, does not apply to Part C. Part D, drug plans, no, doesn't apply to drug plans. What form do you use? Okay, well, there's a magic form. You cannot use any other form if you are on Part B other than the CMS R131 form. Hospitals have their own forms. They're called HINN forms. That stands for Hospital Issued Notice of Non-Coverage, HINN. So the most recent form expired June of last year. So there's a new form. And the new form has an expiration date of 1/31/26. That the form you're using in the bottom left-hand corner says EXP expiration 01/31/26. Field A is at the top of the ABN form. It says notifier. Well, that's pretty vague. What does that mean? Well, that's you. You are the notifier. You are notifying the patient of the fact that they're going to have to pay out of pocket. So you put in your name, your address, your telephone number. B is patient name. C is a field that's optional. It's an internal ID field. Okay, well, you don't have to fill that out. One of the most important fields is field D, which is what's the non-covered service? Why is this important? Well, because you got to fill that out 7 different times. There's a place on the ABN to put in what goes in field D. So let's just say the non-covered service was anesthesia. So you're going to be putting in anesthesia all over the place on the ABN form. E, what's the reason that you think that Medicare is going to deny this? All right, field F. Okay, this is what your estimate. You got to estimate how much it's going to cost. The most important part of an ABN is field G, options. Option 1 says bill Medicare. Option 2 says don't bill Medicare. So those are the 3 options the patient can pick. As I mentioned earlier, field H is a place you can add additional information. I, if patient signs it. J is the date. Okay, additional considerations. You have to use the official CMS ABN form. There are some examples of what the government considers coercive. So the following is considered coercive. Okay, examples for ABN use. LCD is local coverage determination. It's a set of instructions that indicates to you, provider, the limitations on a particular procedure. So anesthesia for chronic pain. It's the same for both epidural LCDs and facet LCDs. So there are multiple manufacturers that make these peripheral nerve stimulators, okay? What about Medicare Advantage? Already covered this. Medicare Advantage, they are required to follow Medicare LCD. It's this organizational termination that I mentioned earlier. Okay, what if there's just no commercial coverage? Okay, well, those of you that are up to snuff on the No Surprises Act, recoupment issues. All right, option 1 says bill Medicare, option 2 says don't bill Medicare, and the patient pays up front. Issues with option 1. Medicare has a special modifier and a special form, the ABN form. Okay, so this option 1 is not a good solution. That's why you want to be in the land of option 2. The benefits of option 2 are, number 1, you don't bill Medicare. You cannot pre-select option 2 on the ABN. Here are my prior experiences with option 2. It can be difficult to get the patient to agree. What if the patient says, you know what, I'm not signing option 2. We either do option 1 or we're not doing this. And you can't make the patient sign. But here's what Medicare says, and this is the key to option 2, and that is with QMBs. So QMBs, that's another acronym for Qualified Medicare Beneficiaries. These are patients who are dually eligible for Medicare and Medicaid. They have to select option 1. Okay, prohibited use of ABNs. Now, Medicare's got these modifiers. We already talked about the GA modifier. That's when you use when you have to get an ABN and you got one. How long do you have to keep an ABN? 5 years. Okay, collecting and refunding payments. Let's assume that courtesy ABNs, yes, you can issue courtesy ABNs. Routine ABNs, they're not allowed. So, except, what if the patient changes their mind about, okay, they selected option 2, but now, by golly, they want to select option 1. Yes, they have a right to change their mind, but you're probably going to have to give them that ABN far enough advance so it's not considered coercive on the date of service. Once you get the ABN back, you can scan it into your software, and that's perfectly fine. Okay, things Medicare never pays for. I'm just going to list them here without going through each item. I'll comment on the last 2. Other than that, I hope you enjoyed the presentation. Thank you.
Thank you, David. That does conclude the session for today. Thank you everyone for participating. You may all disconnect now and have a great day ahead.